I had noticed that my eyesight had deteriorated, and I had a regular appointment with an optician who basically advised me that my cataracts in both eyes needed doing.
I got to the stage where it was really difficult to actually sort of lead a normal life, because just trying to read timetables or even read the paper or just go about my ordinary business was becoming more and more difficult.
The reason I had surgery was because I was struggling to see things close up. Being out and about, out in the elements, wearing glasses wasn't an option, and I used to break a pair every day. When the opportunity came along, I thought, yeah, this is for me, and it would see me out really.
An in-depth and thorough eye assessment is crucial to selecting a lens implant that is appropriate for the patient to be operated on. As part of my workup, I ensure that the patient has all their scans done before they come to see me. This would include obviously corneal scans, retinal scans, nerve scans, a biometry, so that I am able to glean out all the data that is necessary, choosing the right lens implant for them. This is followed by a full assessment, including a dry eye assessment to ensure that they've got a good ocular surface and that their retina is stable and healthy and appropriate for the surgery. What is probably most important with the Elon EDOF lens implant is ensuring that the patient has an appropriate size pupil for the lens implant. The Elon EDOF lens has a 2mm central refractive zone, which is where all the refractive linking technology is focused on. It is very important that the patient selected has an appropriate pupil size, ideally about 3mm, so as to provide the best visual outcome for distance, intermediate and near.
I was really led by the surgeon. I explained what I wanted out of the lenses. I enjoy doing a bit of shooting, so that made a difference. Night driving, that made a difference. So when we weighed up all the options, which the surgeon, was very careful to explain, I decided on having those.
Well, it's been amazing. I can now see to do so many things that I couldn't see to do before. I mean, simple things like, really a timetable, just generally going about my ordinary everyday business. It just made such a difference to my life and brought a new sort of vividness into my life, really. And not just seeing, but with the doing and everything as well.
Almost from an hour after leaving the hospital, I suddenly realized that I could read some number plates on cars. And about a week later, I came back to the surgery. I caught the train, came back to the surgery for a post-treatment review. And I suddenly realized that in the station car park, I could read car number plates that were sort of 50 yards away. It was just a remarkable. And since then, it's gradually improved and improved. And I think it's now 2 months since the surgery, and I'm still seeing slight improvements, although right now I would regard my eyesight as damn near perfect.
So the first thing I'd say about the Elon EDOF lens is that it's a preloaded lens and it's very easy to prime and inject in the eye, which makes it very easy to use. The second positive I like about the lens is its Biflex technology, which means that it's very stable in the eye. All the Tariq lenses I have used have been stable and I have not had to rotate a single one so far. I've had excellent outcomes with these Elon EDOF lens implants. I've implanted both the non-Tariq and the Tariq version, and have done about 50 of these lens implants. All my patients have been very happy with the outcomes. They've all had excellent distance vision, excellent intermediate vision, and very good functional near vision. They do have to wear glasses for small print reading, but they are aware of this as part of the consenting process.
For very fine print on for example, on my iPhone, I've just bought a set of +1 reading glasses, but that's it.
I can read without glasses, and in fact for the first 6 weeks I didn't have any glasses at all. If I'm reading small print in a newspaper, it can be a little bit better if I'm using the glasses, but I didn't need to.
There is a little bit of a halo slightly with the headlamps, but actually I think that's partly because my eyes have been a little bit more watery.
Yes, I would 100% recommend my colleagues and peers to use the Elon EDOF lens implant. It is a very easy to use lens, it is very forgiving, and if you've never used an EDOF lens before, this is where you should start. What I find most rewarding about my Elon surgeries is the happiness and satisfaction on my patients' faces. They are delighted with the fact that they don't have to wear glasses or contact lenses and can get on with their daily activities carefree.
If you'd ask me would I do it again, the answer is yes. And would I recommend it? Yes.
Yeah, I've got a lot of colleagues in farming, and they've all shown an interest into what I've had done, waiting to see what the results are, long-term results, and yeah, are considering it themselves. So yeah, it's been good.
I think that when you can see better, you have more confidence and life is better. And, I'm just so pleased to have had it done.